Thank you, Jennifer. Good morning. Dr. Stephen Thomas here from Upstate University Hospital's Infectious Diseases. We just recently heard one confirmed case, 70-year-old woman who hasn't traveled. So what does that mean?
Right. So it means that it was acquired in the community, is what that means. The second thing it means is that it is what we expected. So we did not expect to not have any cases in Onondaga County. So this was expected, and it's been planned for multiple weeks. The third thing it means is that this is no longer a theoretical reason to practice social distancing and to do the types of things that the Centers for Disease Control and Prevention and the local Department of Health have been advising people to do. And so that's what it means.
So when we talk about social distancing, now that kids are going to be out of school starting today at 4 o'clock, you're not advising that parents like, oh, okay, let's have some play dates, and because kids can still get this disease too, even though we were thinking maybe that they were immune to it.
Right. No, so that's right. So kids can certainly get infected. We do know from some small reports that have come out from Asia that kids can get infected, that kids can get ill. In general, they seem to do much better than adults do with the disease, especially those adults that have that are over 55 years of age, that have pre-existing heart disease or lung disease or diabetes. But the thing about children is, and we don't know this specifically, but it just stands to reason, they could transmit the disease to others. So you can think of scenarios where a child may be infected, you would get a number of kids together, other kids could get infected, the kids may do well, but then they go home to adults, and they may go home to adults that are in that risk category, either an elderly grandparent or somebody that's immune compromised for some other medical reason. So that's my concern about having groups of kids get together.
You also provided, and we'll probably get to these in just a minute or so, the graphics here basically on how you're working to contain it, right? Can you sort of talk us through that a little bit?
Sure, yeah, so the phrase is flatten the curve. So, and I don't know if the graphic will come up, but basically in the absence of any action to try and prevent transmission between people, what you'll see is this big, huge peak. Right, so looking at the graphic, that peak represents the number of COVID cases over time. That horizontal line is the capacity that the medical care infrastructure has to deal with those cases. And so you can see that in the absence of doing anything, so in the absence of any social distancing, in the absence of any testing, we would very quickly exceed the capacity of our hospitals and our primary care providers and other healthcare resources to take care of the problem. And so that's going to mean that people who have COVID are not going to be able to be taken care of like we want them to. People who are there in the hospital for other reasons, people are still going to have trauma. They're still going to have heart attacks. They're still going to have diabetic crises. We're going to quickly overwhelm our medical system. So in terms of trying to flatten the curve, what that means is if we can effectively use social distancing, if people can avoid going into large groups, if we can reduce the number of the amount of transmission from person to person, we can keep that curve below the threshold at the medical care infrastructure, and we can take care of the people that we need to take care of without exceeding our resources. And that's what we're trying to do nationally, and that's what we've planned to do regionally.
Speaking of nationally, you have another graphic, a map that is kind of points out, I'm not for sure as of what time, because things change so rapidly, of where the cases are throughout the country.
Right. Yeah, so basically what this is from the New York Times. It's from the 15th of March, and basically what you see is everywhere in yellow there are confirmed cases of COVID. So pretty much the entire United States.
Oh yeah, West Virginia was the one that...
West Virginia is the only state. And then the red dots are the actual cases, and the bigger the red dot is, the bigger the hot spot, if you will. So you can see Washington, California, New York are huge. There are huge outbreaks going on right now. So again, this is important for people who are trying to minimize what is going on right now, certainly in the world, but right here in the United States.
Can we talk about that? I mean, there's been a couple conversations that I had even this weekend, and somebody said, oh, you know, I can't go to Florida because of this. It's just another cold.
Right.
And trying to say it's not, you know, it seems to be a challenge. So what can you say to people who are still saying that, you know, that this is just another common cold, people are making too big a deal out of it?
So influenza, on average, every year kills between 35 and 40,000 people in the United States, on average. The case fatality rate for influenza is about 0.1%. The case fatality rate for COVID globally is about 3.5%. In the United States, it's about 1.8%, and as of this morning in New York, it's about 1%. So New York, which has one of the lower case fatality rates, is still 10 times higher than what the flu does every year, and the flu, again, kills about 40,000 people. So if that context doesn't get people to be concerned about what is, you know, what is going on. And, you know, the other thing is, again, there is a specific risk group that is at very, very high risk for a bad outcome if they get infected. And these are older people, people with heart disease and kidney disease and diabetes and lung disease, and there are a lot of them out there. So you may be a young, healthy person with no other medical problems, and you may, in fact, get infected and do well. But if you transmit to your parent or your grandparent or your neighbor who are in that at-risk group, you've just done them a very bad disservice.
Well, we saw on Good Morning America today, one of the NBA players, he was on talking about, you know, I believe Robin Roberts asked him, you know, how did you find out that you had it? And he said he had gotten tested, but he never really had any symptoms. And he said, you know, I'm very blessed not to have any of the symptoms, but they know that I'm carrying this because I got tested. And so, and he says, you know, even right now I'm quarantined and I feel fine. Does that happen to where you could be carrying it and you don't even know it because you don't even develop any symptoms?
Yeah, so I think of it as an iceberg, where the minority of the iceberg is above the water and most of it is below the water. So what's below the water would be people who get infected and don't have any symptoms at all, or people who get infected and the symptoms are so mild that they don't even come to the hospital. So those are the biggest groups typically. Those people, they feel fine, but they are still capable of transmitting to other people. And then the part above the water, which is the part that we know about, are the people who get sick. So if you think about, you know, people who get sick, 8 out of 10 people who get infected and get sick are going to have a mild illness. They'll go to the doctor, they'll need to be taken care of, but they're going to do okay. 20% are not. And within that 20%, 5% are going to do very poorly. So they'll be in the hospital, they might be on a ventilator, they might need to have dialysis, they'll need very advanced medical care, and a certain percentage of those will unfortunately pass away.
Well, and I think to go along with that, you know, somebody had asked, like, if certain cases are mild, then how can you truly know? The direct question was, how do you contain the virus if only people who are super sick are actually tested? I mean, is this when social distancing is critical?
No, that's the exact reason why it's critical. Because we're not going to test everybody. That's not what this test is for, and that's not how we need to combat this pandemic. So we test people who are at risk, either from travel or from contact with someone who is known to have COVID. We test people who have symptoms. And, you know, our knowledge is evolving of how people are ill. And so, you know, at the very beginning we thought, well, these are people that develop, you know, severe pneumonia, and they develop what we call ARDS, so lots of inflammation in the lungs, and it's very clear how we can pick that out. That story's evolving a little bit, though. It seems like there's almost 2 phases, where the first phase can seem very much like the common cold. So people may feel feverish, they may not have an objective fever, so when you measure their temperature, profound fatigue, muscle aches or muscle pains, they may have a dry cough. That may be it for them, but then there's a group that's going to evolve into persistent fever, shortness of breath, pneumonia, and then these more severe manifestations. So it's scary, because up front it can be very nonspecific what the illness looks like.
You have a triage number set up that people can call. Talk a little bit about when they're supposed to be calling that. And because if you do feel like you have some of these symptoms, you're asked not to go to the emergency rooms or to your doctor. That's
correct. Yeah, so what we're trying to do here is we are trying to make sure that the people that are in the emergency department and the people that are in the hospital are the sickest people. All right, so that we don't overrun, back to that curve, we don't overrun our capacity to take care of people. So we're encouraging people, first, call their primary care physician. If they don't have a primary care physician, then they can call this triage line, the Upstate triage line that was already mentioned before we came on. And the triage line and or their primary care physician can give them some initial guidance. And the guidance may be reassurance, you're okay, we'll check back in with you later. If the primary care physician thinks they need a face-to-face interaction, then they can do that, as long as they have the proper personal protective equipment, which is what we're working hard to make sure all the ambulatory care and primary care physicians have that. And they can even test them. So testing was very limited at one point. The Wadsworth lab in Albany, the Department of Health lab in Albany, they're doing an incredible job. The turnaround, we've sent them many tests. The turnaround time is very quick and the process is working. But now we have commercial labs coming on board as well, up to 4 commercial vendors who are offering testing, and at least 2 of them locally. So now we're going to have increased access to testing. The primary care folks can then see those patients, again, outside of the emergency department. So the hope is that we can kind of create this sieve where the people that end up in the emergency department or end up in the hospital are really the sickest people and the ones that need to be there.
Before we go, any sort of final thoughts? I know this is probably not going to be the last that we see you here at News Channel 9, but any sort of final thoughts this morning?
Yeah, I would really make a plea for people to adhere to the social distancing guidelines that people are putting out there. Take it very seriously. Continue to wash your hands as frequently as you think about it. Don't touch your face, and good respiratory hygiene. So if you have to sneeze or cough, do it in a tissue, throw it out, wash your hands, do it into your sleeve, wash your hands.
Really quickly though, since we have this first case confirmed here in Onondaga County, will we start to see more cases, and then how long can we expect that curve can be up until it starts to go back down?
So to answer the second part first, I don't know. Okay. To answer the first part, we absolutely will see more cases. Yeah. We absolutely will see more cases.
There we go. There we go. Well, in the meantime, that COVID-19 triage line, we want to remind you one more time, 315-464-3979. You are urged to call that number if you are experiencing any symptoms of COVID-19. And in the meantime, we ask you to stay with News Channel 9. We will have updates throughout the day related to the coronavirus. We're available online, localsyr.com. Thank you, Dr. Thomas.
Thank you.
Thank you.